Giving birth is a life-changing experience for a woman, and every woman has her unique birth story. While some women give birth vaginally, others require a cesarean section, IC section, due to various reasons such as fetal distress, prolonged labor, or medical complication. However, for women who had a previous C-section, the idea of having a vaginal birth after cesarean VBAC may seem daunting. After all, they have been through a major surgery and wonder if their body can handle labor and delivery. But with the right preparation, a VBAC can be a safe and empowering experience for women. In this video, we will discuss everything you need to know to prepare for a VAC, including the benefits, risks, and how to increase your chances of having a successful VBAC. Benefits of a VAC. VAC has several benefits for women who had a previous C-section. Firstly, it eliminates the risks associated with major abdominal surgery, such as bleeding, infection, and longer recovery time. Secondly, it allows women to avoid the risks of multiple C-sections such as placenta previa, uterine rupture, and hysterectomy. Thirdly, VAC has a lower risk of respiratory problems in newborns compared to scheduled ELCC sections. Fourthly, VAC is associated with a higher likelihood of successful breastfeeding and bonding with the baby. Therefore, a VBAC can be an excellent option for women who want to avoid repeat C-sections and experience a vaginal birth. Risks of a VBAC. While VAC has several benefits, it also comes with some risks that women should be aware of. The most significant risk is uterine rupture, which occurs when the scar from the previous C-section tears during labor. Uterine rupture can cause severe bleeding, fetal distress, and may require an emergency C-section. The risk of uterine rupture is relatively low, estimated to be around 0.51. But it increases if a woman has had multiple C-sections, has a vertical uterine incision, or has gone past her due date. Other risks of VBAC include longer labor, infection, and the need for instrumental delivery or emergency C-section. Preparing for a VBAC. Now that we have discussed the benefits and risks of VBAC, let's talk about how to prepare for it. Firstly, women should find a healthcare provider who supports VBAC and has experience with it. They should discuss their medical history, including their previous C-section and any concerns they may have about VBAC. Women should also stay healthy during pregnancy by eating a balanced diet, exercising regularly, and attending prenatal appointments. They should also educate themselves about VBAC by reading books, attending childbirth classes, and talking to other women who have had a successful VBAC. Additionally, women should prepare for labor by practicing relaxation techniques, creating a birth plan, and considering the use of a doula or midwife, increasing your chances of a successful VBAC. Finally, let's discuss how women can increase their chances of having a successful VBAC. Firstly, women should wait at least 24 months after their previous C-section before attempting a VAC. This allows the uterus to heal adequately and reduces the risk of uterine rupture. Secondly, women should go into labor spontaneously rather than inducing labor, which can increase the risk of uterine rupture. Thirdly, women should aim for a vaginal delivery before their due date, as the risk of uterine rupture increases after the due date. Fourthly, women should consider a trial of labor after cesarean TOLAC, rather than a scheduled ECC section, as TOLAC has a higher chance of success for VBAC. Lastly, women should choose a birth location that supports VBAC and has the necessary resources, such as an on-call obstetrician and a neonatal intensive care unit, NICU. In conclusion, preparing for a VBAC requires careful planning, education, and support. While VBAC has some risks, it also has several benefits, including a faster recovery time, lower risk of complications, and a